Welcome to Complicating the Narrative, a podcast that takes on the challenging questions in public health by embracing complexity rather than avoiding it. I'm your host, Salma Abdullah. Today we're exploring a new book that has sparked deep reflection across the field of global health, The Foreign Gaze by Dr. Seye Abimbola. It's a collection of essays that blends the personal and political, asking us to reassess what counts as knowledge in global health. At its core, I think the book argues that academic global health still often defers to what Seye calls a distant, powerful foreign gaze, one that shapes what we can see and what we can say. He invites us to re-envision the ways we can make and use knowledge to achieve global health equity. Seye is an associate professor at the University of Sydney in Australia. His work focuses on governance in global health systems and politics of evidence. He's also the founding editor-in-chief of BMJ Global Health and one of the most reflective thinkers in the field. Seye, welcome to the podcast.
Thank you very much, Salma. It's very nice of you to have me.
This is an interesting conversation for me because I've read your work, I think maybe 10 years ago. I think maybe the first work I read was 10 years ago. And I think I asked you last year if you think your thinking has evolved over the years or your writing has just changed as the situation demanded that it changes, or what have you been more radicalized on versus what you've become more pragmatic on? So I read the book and then I reread it after conversations we had. And I think it's fascinating to me because I reread one of the earliest paper I read of yours. And it seems to me that every time I come with a different reflection. So I don't know what that says about me or your approach to writing, but I just think a lot of your writing just invites a lot of reflection, which it's hard to say that about a lot of the writing we have I think in global health. I wanted to maybe start with your journey and how your thinking evolved from your experiences, starting in medical school all the way to now, and what led you to write The Foreign Gaze.
Thank you very much. Those were very nice comments. And I hope we return to some of that later in the conversation. I am one of those kids who smart enough in sort of primary school, high school, could do nothing else but go to medical school. In fact, because there were sort of a limited range of options for me. And my mother was a midwife, and I'd had a lot of exposure to health, as it were. So it felt like the natural next thing to do. And I enjoyed medical school a lot, and I would still do it again, in fact. But I knew very early on that it wasn't for me, that the practice of it was not for me, but that the science of it, and just the amount of hard work and rigor it took, and having to hang out with really smart people for so many years. In Nigeria, it's a 6-year program. And because when I was in medical school in Nigeria, it was a very political period, and there were many university shutdowns and strike actions and student protests, that it was actually 8 years of medical school. Which meant that I really did enjoy it, but I knew I didn't want to do it, and I had enough time to plot my exit from it. And so from like year 3 out of 6, I knew that I had to get out, and I had time. And on my list of options was public health. Again, because it spoke to what I had grown up experiencing as a child at home. So I finished, got a scholarship to come to Australia to do a master's in epidemiology, which I did, then returned to work at the National Primary Healthcare Development Agency in Nigeria. And what I found interesting there, and perhaps what I may describe as the start of my global health journey, global health in the traditional sense, was that it was the agency responsible for national immunization programs in Nigeria, and for a lot of things that international people were interested in. So I had a lot of opportunity to engage with quote unquote global health people. And it was striking to me how much power they had, and how much little they knew, and how much certain they were that they knew a lot. But also how much we at the national level deferred to their supposed knowledge, even when we knew better. Right? This was not an assumption that they knew more. We knew more, but they had money. And money was important for good and bad reasons. And people were willing to take that. And it shaped a lot of what we did, even when it made no sense. Now, on the other side of that was also this recognition that those of us who were working at the national level also knew very little about the realities of people within communities in Nigeria, what they needed for health and care. But also we did exactly the same thing the international people did with us, which is that we knew very little. We were certain we knew a lot. They deferred to us, and we were able to do the things that we wanted to do. So I was sort of in the middle of that, and there was an unease with that, but also a growing, I suspect, determination to try and do something about it. So I did my PhD on the latter, on sort of on how we at the national level may think and see how communities organize for health better. And then on the first side, which is on the international side, I got to later.
And then you began as an editor-in-chief in BMJ Global Health. Does that help with the thinking about the book as well?
I don't think I would have written the book without being editor-in-chief of BMJ Global Health. I feel, there's a version of my explanation of the book that is a set of reflections of a frustrated editor. In other words, a lot of what I wrote in the book were things I wish I could say to people as an editor, but I knew that it was not my place to say to people as an editor. So in a sense, you could sort of read that book and say, this is what an editor is trying to say, but can't say. So he's saying it in a series of essays.
So I want to go through the chapters one by one, because I think I don't know if you aim for it to be that literally or to have the prose for it to be that beautiful, but I like the title, so I'm going to start with the title of every chapter. But before we do that, I also don't want it to be remiss of the introduction, because I like the idea of thinking of metaphor of a photo shoot. Do you want to maybe just explain that a bit for us?
So something I wanted, almost a disclaimer at the start of the book, was to say to people, this is not a comprehensive book. It's not a book, really. I struggled to even call it a book. I had to eventually. For me, it was just a series of essays. It's an essay collection. So I wanted to give a sense that I was taking snapshots of a certain reality, and it's just a few snapshots, 7 of them, right? And you can make of that what you will as a reader. And what I imagined to be what I was taking snapshots of was a relationship, like a conversation between two parties. One taking a photo shoot, and the other posing for it. And the kind of co-constitutive nature of that relationship, where I pose often following the cue of the person who is behind the camera. And the person behind the camera exerts a kind of power and influence on what I do, but I could also choose to disregard that person, depending on how I feel about what they're asking me to do. So, in other words, it's a relationship that is both responsive to each other, but also could not be. Parties could choose not to respond. And then thinking of that as the knowledge production process in global health, where this person speaks, there's a person who listens and captures it, often through a medium, which could be a camera. I'm often imagining an academic journal or other kind of platforms that serve that kind of purpose. And there's that relationship, right? And I'm just taking that snapshots of that relationship from different points of view.
And then, so you've titled the first chapter "In the World, but Not of It." And so you give a lot of nods, I think, to your mother also throughout the book, which just fully resonates for me as someone who just, I think my mother just, I think she shaped almost everything that I am today. I don't think anyone else had as much power on how I think and what I do in the world, including, as you said, being a doctor, because you were smart enough to get a good degree to get into a specific field, even though she's a teacher, but I knew she just wanted me to be a doctor. But I love the nod to your mother, but I think even in the chapter, the first chapter, you also think about her relationship and her being in the specific world of a church and being also as a midwife/nurse. I thought that was a really helpful way of thinking about, like, what is our position when we're thinking about what is our position in a specific situation, how do we envision the situation, but also how can we really contribute if we don't really understand where we are in a certain space and time. So can you tell us a bit about that?
So the line that is the title is from the Bible. And as you were already mentioning, I often say that I grew up in the church. I mean, it wasn't like I was living and sleeping and waking up in the church. But when we went to church every day, and I had richer relationships in the church than I had at school, for example. So I still remember my church friends as a kid more than I remember my school friends as a kid, because we were there every day. So there was a sense in which that was my life. But she was a nurse midwife, and the church didn't allow for going to the hospital or seeking care from the medical profession. So she was this symbol of that medical profession. She, and again, nurses, midwives wear uniforms. They are known on the streets. So it wasn't a position she could hide. I'm not sure she wanted to hide it, but she couldn't hide that. So it was who she was in church. And she had to navigate trying to create something in the church that could basically save lives. Because it was clear to us, it was clear to her, and I knew secondhand very often that bad things were happening to people, children, women especially. And for me, it was watching her navigate insider outsider position in the church. Insider being a member of the church, she was in the system, but also she was a nurse midwife who had to function in a different way, and also had to function in a way with people in the church that was not condescending, that was not saying to people that you don't know what you're doing, that was not even trying to bring in something external or something that appeared to be external. So even in her bringing her professionalism into the space of a church, it had to be disguised as something that you all could do, you all were doing already. There was a whole set of dynamics at play, and the richness of that for me became more and more apparent as I got older. That was high level politics going on in being able to deliver things in that way. While sort of navigating that insider-outsider sort of post or stance. And it's, in a sense, helped me think about what global health means or could mean. And also, in a sense, something I was trying to achieve in the book is to be able to allow a zooming in and zooming out, that you can sort of interpret global health as a one-on-one relationship, as much as you can interpret it as a global north, global south relationship. And you can sort of imagine it at different scales. And I was sort of picking on different scales throughout the book. And in the first chapter, I was thinking a lot about that very intimate space where someone has more power than the other person, and has to relate with them as equals, respectfully, while it's also being useful. And that was sort of the motif I was trying to play with in that chapter.
And you have your own definition of global health in the book. I think it would be good to ground maybe the conversation in that definition. But also, I think another term you use is knowers on the ground, which I think maybe this is where we would have a conversation on later. It would be good to also define what do you mean by knowledge? Because I think you use the term a lot throughout the book.
For me, and again, I feel influenced by those experiences. Global health is for me any effort to reduce, eliminate inequity everywhere, grounded in principles of justice and the dignity of people. And of course, what that definition impels is the sense that the person doing it has more power than the person on whom it's done or with whom it's done, as it were. And that there is a sense in which the person who has more power also has more knowledge, right? Especially you can imagine from the position of my mother, that she knew the things that needed to be done to maybe make people healthy, keep people alive. But the person on the other end of that relationship, or the institution, as it were, the church, there's also a set of configurations there that my mother needed to know, that the people in that system knew. In other words, all the policies I was describing that she needed to be able to navigate were things she needed to learn from the people who were there. In other words, there's a certain kind of knowledge that the people in a system have, that anyone who wants to be of use has to learn. And again, it's not the use of knowledge in a necessarily positive sense, right? It's not saying or in a sense that sort of connotes a kind of morality that they are good people. Of course, they are good people, but it's not that's not the assumption, right? That they are good people and they know this and they're virtuous. The knowledge could also be the knowledge of what you need to do to keep women down. That may be that knowledge, and the person who wants to be of use has to figure that out. Has to figure out what these people are thinking because they are not empty vessels. So it's that kind of knowledge that is situational and situated and also political at the same time. That people in a space, a system hold, that you who are in a position to be engaging with them have to respect the existence of and try to figure out. So that's the way first that I'm thinking of global health, but it leads immediately to how one thinks about knowledge in the practice of it.
That's really helpful because I actually have a question for you later about the morality of some of the positions that you're taking. I think it's actually a helpful distinction for me to think knowledge, it's amoral. It's just, it's knowledge exists. It is situational, as you said. It doesn't necessarily have to connote any type of morality to it. It could be, as I said, it could be knowledge to help women who really are pregnant and would like some support, or it could be knowledge to also just keep women in a certain position. That is actually a helpful distinction for me. But this, I think, brings us to the next chapter, which I thought it is based on one of your famous articles, one of the articles I read early on, the distinction between gaze and oppose. Do you want to tell us maybe a bit about that for those who have not read the article?
The article, again, on the theme of this book being a collection of essays of a frustrated editor. It was one such essay. It came, I wrote it initially, the first version of it, to accompany a set of papers that were demonstrating the authorship imbalance between global health articles, between authors in the global north and in the global south. And it was showing that even for research done in African countries, that much too often the first authors and the last authors were based in the global north. And at this point, this was already a well-known thing, but it's always useful to demonstrate those things, especially to demonstrate their evolution over time. And the evolution over time also showed that even when African authors were included in papers in their location, they were often stuck in the middle, as it were. Sort of, and in public health and medicine, the middle position is the least powerful, consequential position on the byline of a paper. And what I was trying to do with the essay was to sort of acknowledge the importance of that, but to then say how might we think about what we do with this problem. In part because you may have a paper completely authored by people in Malawi, doing work in Malawi, and it still reads very much, will not be different from one that is first and last authored by people in the UK, but done in Malawi. Right? And then what do we do? What do we do then? And I was interested in then positioning the role of journals as especially a force that can shape what people in Malawi do in Malawi about Malawi in a way that may make them not very different from people if they were people living in the UK. Because the people they are trying to impress, the people whose needs they are trying to serve with that knowledge production are in the UK, perhaps the Lancet, the BMJ, etc. And so I wanted a language and a framing to describe that power that is wielded by the supposed audience of the work and how that could shape what work gets done, regardless of whom is doing it necessarily. And so hence this concept of gaze, which pre-existed, predated my appropriation of it. The male gaze, the etc. But at the same time, I was interested in then also reflecting on the positionality or the post. And I didn't want to use the word positionality because it meant something else. It meant something more specific to people. So I wanted a different coinage. And I liked that it had 4 letters, post, and gaze had 4 letters. I obsessed over the structure of words and the sound of them. Anyway, so then it was pose and gaze. And I like the pose because pose also then connotes a positioning of oneself deliberately. And so the idea of pose then is, okay, so person writing in Malawi could choose a different pose, could choose to pose as if they were foreign to appeal to the foreign gaze, could also choose to pose as if they were local and disregard the foreign gaze, even if they were submitting to the Lancet of the BMJ. Just in the same way that a person who was foreign to Malawi could choose to pose as if they were local and address themselves to local needs, regardless of what the foreign gaze would be demanding of them, etc. So it was a formulation of how does one think more comprehensively about this thing that we call authorship, that does not default to a simple cosmetic representational logic, but actually goes deeper into the substance of the work and the structures that shape.
I agree. The article I thought at the time was great. And I think because of it and other articles that created a movement, I think journals tried to understand how can they address some of those issues. I think you talk about how the movement to try to really understand authorship and how can we tackle inequities in authorship is helpful, but that does not necessarily address the root of the problem.
Yeah.
I think that's throughout the essays. My struggle here is, so I was supportive of this movement, and maybe this is, I'll just tell a personal story, and maybe this comes then from my biases, because then now I'm here, I'm in the US. If I want tenure, I need to submit articles to certain journals to get tenure. But I think it was interesting to me because during COVID, I was working with a few colleagues in Sudan, early days of COVID, and I was trying to think about the gaze and the pose and how does that reflect to that certain situation where my colleagues were working in Sudan and I was working with them, and then we wrote something about Sudan, what's happening in Sudan. And I think I got a lot of journals saying, well, we can't publish this because you don't have anyone from Sudan with you. Because my colleagues in Sudan can't write really an article globally given the government we have in the country. So I just wrote it up because I'm here. And I got really frustrated for a while because I kept thinking, well, it's as if people are denying my identity as someone who's Sudanese by saying, oh, you just have an email address that is in the US. So the answer is you don't have anyone from Sudan with you. And I think you do write about sometimes you need to write for a foreign gaze if the local interventions are hard. Like it's just hard to actually create a movement locally, if I'm not mistaken. But I think then there was a question for me, honestly, and I don't know how would you deal with that situation personally, because we have comparable, I think, life trajectory of also living in Australia, of in the moment, is the reflection to say, am I writing this because I think it's helpful for people in the country? And systems moving to just, I don't want to say journals are trying to avoid people being outraged by just having very yes and no, simple criteria of you don't have an address in Sudan or affiliation in Sudan right now, so we're just not going to publish in Sudan. Should we ask more of journals? Or at the same time, maybe the author, who's me, should reflect more on like, why do I think it's helpful to actually write about what the Sudanese government is doing to try to address COVID in the moment. I am, to be honest with you, I'm of two minds on this. I can see both arguments. So I wasn't sure how you think also sometimes about when you write about Nigeria or you write articles in journals, how do you think about the trade-offs there?
I hardly write about Nigeria these days, but that's a different story. I think both of those things are necessary. I think it's useful for people to ask themselves where they are writing and to be honest. And I feel like that's part of what I was trying to do with the essay, which is, really ask yourself. And I was often, having a throwaway, in my mind, it was a joke in the essay, that, declare why you are doing this, right? And say it in my mind, it was a joke, but eventually, over time, it became something I wish would happen, really. That people should be willing and able to introspect and declare. But at the same time, also, and I did this a lot as an editor, to not limit and reduce people's identity or positionality, as it were, to their current affiliation.
Mm.
People didn't always agree with me, right, on this, but it's important. And I've had to push back on journals. I'm part of a project that's being led by someone who is from an African country and who is on a scholarship to work with me. And because this project often has the word global health in it, which in itself is a problematic label, because it gives people all these kind of ideas of what the work is about. The journal said, well, there's no LMIC author on this. And I was like, if this was submitted 6 months ago, there would be an LMIC author on it. Right. So what do you think that means? Right?
Yes.
So again, there's this tendency. There's this tendency to do these things that sort of unreflexive, that you can just tell people are not thinking, or that they feel that there's someone who they are trying to impress, and they can't allow themselves to think, because if they were to be thinking deeply, they may fail to do that. So there's that problem, and I feel again it's on both sides. Journals and people who think about authorship should think more carefully about it. There are things that are easy to measure in these discussions about authorship imbalance, which is sort of gender, or sex, affiliation, etc. So we measure those, and they are a crude measure, and they indicate something. But when it comes to the individual, again, it's the same logic when we think about epidemiology, right? Like there are things that make sense at the population level and can tell you something about trends and directions. But when it comes to a person sitting right in front of you, you have to bring down your thinking hat. You can't. Anyway, so you see what I mean? Like, again, both of those things matter.
And I fully agree. I think that's also part of the danger here, because I think after at least my second read, you were trying to have a very nuanced conversation. And I worry that it is almost always the case that the solution is simplifying something, because I don't know if people don't want to take the time, or it's just hard to be reflective or think maybe a bit more about a choice versus just saying, no, we can do one thing and that fixes the problem. And I like, at first I was really saying, like, why can't you just give me, like, when you were writing the essays, like the end of the chapter, like, what do you want us to do? And then as I thought about it more of my own experiences, I realized that's actually the hardest part. And part of what you were saying, I don't want to put words in your mouth, is it is actually hard to give a very prescriptive, just like all situations can actually be handled by a certain answer. So I wanted to talk a bit quickly about our, I think, shared dislike of using RCTs to address social problems. That was mostly the idea of the third chapter. That one, I'm fully on board. I don't even know if I have a question to push against that, but can you tell us a bit about your experiences thinking about RCTs and decentralization? I think we might disagree on decentralization as an example, but I think we agree on RCTs.
Where should I start? I think, again, you asked, your first question was something about how I came to global health and to think about it the way that I do. And one of my earlier experiences was when I was working at the National Primary Healthcare Development Agency in Nigeria. We were running something called the Midwives Service Scheme, which essentially we're trying to find midwives who were recently retired, newly qualified, or out of a job, and repost them to parts, especially of northern Nigeria and of rural parts of southern Nigeria, where they needed more midwives. And it was a very, very messy process. Very messy process and very difficult thing to run from the national office in Abuja. And then the World Bank came one day and they said they wanted to do an RCT of the program. And they gave this talk. I was in the room, and it didn't make any sense to me. Like, it's either that you guys don't know what you're saying, or you know what you're saying and you're just bullshitting us. And we as a collective, we said yes to them, and I kept. I had this debate in the room where this was happening against them, and you could tell that they were unhappy with the debate. At the end of it, one of my bosses pulled me aside to say, "Don't do that again." They've come with money, and we're going to do that.
Okay.
Yeah. At the time, I did a quick and dirty, really rough analysis of what the data that we had at the national office was telling us about this program. And I was published in PLOS Medicine, when the old PLOS Medicine, and I shouldn't talk more about PLOS Medicine now. And the findings were straightforward, basic things that were useful for us, as it were, in doing the work that we did. It wasn't some grand, sophisticated exercise, but it was just, what can we learn from what this data is telling? And the RCT rolled out and eventually was published, I think, 5 years down the line. And it didn't say anything different. If anything at all, it said less than the 3-month exercise that I did, in the little office that I was sitting at in Abuja. And I feel like that's one of those foundational moments in my head where when anyone says they want to do an RCT of a complex social political intervention, I'm asking myself, do you know what you're talking about? Because even if, let's assume this RCT could possibly tell us anything useful about this thing, it will tell us what is useful about this thing now. If another team was running this program next year, it may not tell us anything useful about this anymore. Likely won't. Right? If it was being on a different set of states, probably not. In other words, it's just, and then there's this sense that you could say that something as complex, dynamic as that works with a full stop, right? And it maybe worked, right? It's also this tense thing here. It worked at a particular place and time in a particular set of circumstances and conditions, which you can't promise or guarantee next month. Anyway, so it's those assumptions we make, and also what those assumptions mean about the people who are intimately familiar with that thing. Because again, to do that RCT, you have to tell yourself that these people don't know what they know. Or at least that they are confused enough for you not to engage with them deeply about what may constitute useful knowledge for that thing, assuming that these people you are talking with actually want to do good with that thing. Anyway, so that was the premise of that thing. And a big initiative, also when I was at the National Family Care Agency, was the performance-based financing initiative that was being, again, World Bank initiative. And a lot of the evidence for it had been RCT evidence from very peculiar places, right? Peculiar post-conflict places that were going through radical governance rearrangement. And then you bring that and you say that it works, right? In those places, and you bring that to Nigeria that will not go through a radical governance rearrangement in my lifetime. Because it's messy already as it is. Anyway, so it just didn't make any sense to me. And we, again, in the office, we knew that.
Yeah.
We knew that it didn't make any sense, but we did it. Right? We did it. And I was, again, part of a team that was very involved in it. And again, it's one of those things that I know that when people say they have local buying, government buying, all of those things that people say they have when they justify doing a thing, it is often a lie. Right? And there's this saying in Yoruba that which basically means two parties cannot be the losers in a lie. Right? A party knows a lie is being done to another party. Right? And I'm always asking myself in these relationships, who is gaining the upper hand in this lie? Like who is winning? Is it us, taking the money because we know we need to take the money, or is it the guys who come in knowing that they are doing DS, but doing DS anyway because they're taking the money as well from their employer? Right? So I'm always iffy about it. But you get my point.
Two things resonate with me, and I think you said it earlier. So I was part of working with the Minister of Health in Sudan, and that was almost always the dynamic. And it was interesting to me that our priorities were the priorities of what the World Bank tells us. Like it's just more than the WHO, to be honest. And I think it's mostly because money talks much more. And Sudan is a country that for a long time was pushed to actually liberalize a lot of its policies and affect a lot of the the social and welfare policies that we had for a while. So I always thought it was interesting to say, as you said, the country is really enthusiastic about this. And I always wonder, who's the country? Who's enthusiastic about something? Can someone who's in I think you're less cynical than me. You're thinking, which one of us is getting the upper hand in this? I always thought it felt a bit more coercive that we actually are doing a vertical program, something very specific, because there's the money there, and I can see like the rest of the healthcare system crumbling in a certain area. I think with RCTs, I'm trying to be generous. I really am, and I don't know if you can think of examples, because that might be helpful for people where RCTs might be a helpful part of the conversation. I'm never willing to dismiss any source of information that we get, but it's almost hard for me to think about, given the level of cost that comes with an RCT for a complex social intervention, to say exactly what you said. Like, it has to, it is controlled by definition. So it is very hard for me to think about the generalizability for that, not just for a different place, but for tomorrow, like after we finish today, as you said, exactly what's going to happen tomorrow. But I don't know if you can think of good examples of RCTs that have been helpful for thinking about policy decisions.
I can think in the abstract about an example of an RCT. The intervention will need to be sufficiently simple. In other words, I can see a spectrum of complexity of an intervention, where at one end is like decentralized governance, like reshaping everything, right? At the other end is like paracetamol. And somewhere in between, you can have, say, a device, a tool, something that has, a bit of stability to it. And then I can imagine setting up a learning process that includes randomization, right? That sort of says, for you guys, do this. For you guys, don't do this, and let's see how it goes. And then we retool and reassess as we go. Now, that is not an RCT in a traditional sense, because again, I would expect, I would not be comfortable with you saying, do this and don't do anything else, right? I'll be wanting to retool as you go. If you learn that you do it this way in a better way, go ahead and do that in a better way, right? That kind of thing. And then see how it goes. And in that sense, I can see, if I was a district health officer or a state government minister of health, I can see how I might set that up as a learning exercise to improve how we do things and to learn about the effectiveness of things. So I can imagine that, right? But in that case, I would not be making any of the claims that RCT people make about RCTs. The claims I'm making are different. The point of the exercise is different. I can see that, and I will, I would likely do that myself if I was running a system like that. I would likely do that. But it's a different thing on the other end of the spectrum.
No, and I agree. And I don't want to harp on RCTs too long, but I think part of my thinking on RCTs, it evolved over time. I used to think when I first came into this, maybe I was too naive. I think one of the earlier RCTs I was reading about is, we're giving money to people in Kenya, and does it work or not? And I was thinking, I think it costs more to just maybe give more money to people. Over time, my thinking about this changed a bit, I think. But I think it's what is the issue for me is that we put RCTs on a pedestal, that is the pinnacle of evidence that is needed. And without an RCT, you can't really say this something works or not. Or with an RCT, you are allowed to generalize way more than any type of knowledge that is available. Like, to be completely honest, like, I've seen some of the RCTs on universal basic income in the US here. That is readjusting some of my thinking about, like, how does universal basic income work in a setting like the US with complexity, like taking that into account. So that information updated some of my priors, but I wouldn't say that's the pinnacle of what I think is the evidence that guides our process. But so that's how I usually also think about RCTs. But I think just moving then to the next chapter, which I think you talk about thinking in two triangles. And maybe here I was thinking, if you can explain a bit about the two triangles, but I also like that you help the reader, again, if I understand correctly, think about, like, how is that just a good approach to think about the work you're doing that helps grounds whether then your work is really reflexive of both your pose and the gaze. But maybe you can just walk us through the two triangles and how should we use that approach?
Another article on the theme of a frustrated editor. So this essay was initially written to accompany another one that had been written by a group that I was a part of, a WHO group on health system governance. And it felt very much to me at the time as like a minority report, but of course I didn't call it that. So the group had developed this framework for thinking about governance that was very static in my mind, even though it was claimed to be dynamic. A static in that they had, and it was about people, sort of government, community, service providers kind of configuration. It was a bit more complex than that, but it was too simple for my mind to see as very useful. And I had done a lot of my PhD work drawing on the institutional analysis and development framework from the Ostrom group, so the group of economists, political economists, often described as the Bloomington School of Political Economy. And they didn't describe what they were doing as a triangle, but it felt like a triangle to me, and I constructed it as a triangle for my PhD, and I sort of carried that with me everywhere I went, sort of using it to think about how relations work in a governance setting. So I sort of written that as a response to that, and of course it was published both of them were published in BMJ Global Health, right? So they both came out on the same day, and that was the best I could do as an editor. Again, as an editor, you don't go about telling people they are wrong in public. So anyway, so that was the origin of that essay. And again, the goal there for me is that every system you get into, or everything you are trying to explain, it's useful to try and, at least in the moment, sort people into roles, as it were, based on how they're able to be influential to other people in the system, and the influence they wield and the roles they play. So one is sort of constitutional, and this was again developed by political economists thinking about federalism for the most part in the US. What was constitutional? The other was collective, which sort of thinks about community groups and similar entities who also make, change, monitor, and enforce rules, just as a government might make, change, monitor, and enforce rules, right? And then there are the operational actors who respond to varying levels and doses and proximities of influence from the other two actors, right? So again, when I'm sort of trying to make sense of a system, I try to sort them into this and sort of see what's going on. And I'm thinking often from the place of making, changing, monitoring, and enforcing rules. Again, all of these are in a later essay in the book. I talked about useful fictions, right? So these are useful fictions. They are not. It's not the reality, but it helps you make sense of reality in the moment and holding it just as loosely as you need to, because it's not reality, it's a framework. But it helps to think about that. And it also then helps you think and ask yourself, because the constitutional level is typically distant from the operational, and the collective is often much closer, there's a way of thinking about trade-offs in which rules the constitutional is able to make, change, monitor, and enforce effectively, versus which ones can be made at the collective level. Etc. So it plays with the idea of distance, which I sort of started the book with, but also with the idea of who is in a position to make, change, monitor, and enforce rules, or to advise, or to study, and to what end does one study that process, depending on how distant one is to the system one is studying. Right? So it sort of brings together a few of the ideas in the book into that kind of framework to help, hopefully, people think about what they are doing when they are analyzing a complex system.
So the question there I have is, this is one of those chapters, and I think I have those questions later, where it felt like it is very much values based, which is that was interesting to me. So the question there for me is, it makes some assertions about distance and scale, which I agree with for the most part. But then I was thinking, when we say distance and scale have an impact on effectiveness, do we think of that as it always in one direction? Because I kept thinking, like, is there a way for us to think of this, like, should this be the guiding principle all the time, that distance and scale are one direction? That always means higher scale or greater scale, and further distance means that we have less effectiveness. Should we always think about it that way?
Depending on what we are holding constant.
Yeah.
Right? It's like saying it takes longer to fly from Sydney to San Francisco than from Sydney to Melbourne. It takes longer. But it also depends, right? on several other factors, which may be the nature of the aircraft, etc. Right? So there are things, to my mind, that are basic in that it takes longer to fly from Sydney to San Francisco than from Sydney to, say, Perth. But of course, it's not It's not always so. It's not necessarily so. That there are things you can play with, and one of the things I was hinting at in that essay was also the role that technology can play in changing that reality. Right. That of course, scale, it's harder. But if you have technology that gives you a certain visibility of systems, or if you have people running the system that are just really know what they're doing, you can have two settings in which the outcomes are against that prediction, as it were. But to my mind, it's basic enough a claim to make.
I think I was thinking if an economist read this, they might think, oh, we actually have economies of scale. Amazon is amazing for its customers. It might not be great for the people who are working there. So I think that might not be a claim for that. Just economists might have a different way of thinking about scale and distance. Like some people make an argument NHS in the UK is much better than the system we have in the US. But I agree with you. It's just, at least from my understanding from what you're saying, we should think about distance and scale as something on a basic level. Distance and scale is something that is just a reality. It just makes it harder. And then what are the other factors that might affect whether scale or distance should be considered in a decision? Is that correct? Am I getting what you were thinking?
Yes.
Correctly?
That's a good way to say it. Yes.
Yeah. So then I have to ask you, the question I think of the chapter was the limits of the foreign pose. What are the limits of the local pose?
There are things that you don't see fully. Or rather, there are things you see differently if you are within a system than if you're outside of it. There are things, and I mentioned this in the second chapter, in the foreign gaze chapter, about how being inside of a thing can limit your ability to see the thing. So in a particular way, yes, of course, you're not vouchsafed, you're not granted wisdom, as it were, simply because you're local to a thing. Right?
Yeah. And I think it's fascinating to me. When I first came to the US, there are three things I was fascinated about that are normalized. But I think just being an outsider here made it easier for me to say, oh, this is actually just completely different from how we do things in Sudan. So then chapter 5 is it's about the use of knowledge. And I love the idea of also, of course, you had to bring in Greek or Latin to the chapter. So can you tell us a bit about the concepts of primary and subsidiary? And I think here we might have a conversation also about who's primary or who's subsidiary, depending on the situation.
So as I mentioned earlier, I was trying to think. I'm always trying to think in ways in which the concepts I'm thinking with can travel across scales. And this chapter is an example of a concept that in which that was the most important thing on my mind, right? In other words, I wanted to think of a way of thinking about knowledge that can apply inside of a small physical community, and that may also apply at the most macro of scales, right? So I was trying to sort of sort knowledge actors in a system, again with the bias of that formulation being that the goal is to achieve equity and justice in a system. So who are the actors involved in that enterprise in a system, and how might we think about it? And the idea of the principle of subsidiarity again comes from that kind of place where a concept can travel across scales, right? So there's the concept that applies a lot in the design of Greek city-states, right? Where there are entities that there are roles and responsibilities that are left to proximate actors to do, and that you sort of think about subsidiary roles for more distant actors, which include things that require economies of scale, as you mentioned earlier, but could also be things that require thinking across units, where a person inside of one unit is not able to get visibility of what's happening across, right? But it was also a concept that is very much adopted by people in the Catholic Church, right? For how one thinks about the governance of relations in a community. Again, thinking about the responsibility of families, for example, versus the responsibility of a larger, more powerful entity like, say, the church. So it's that kind of concept that also allows you to think across scales as to how one thinks about governing relations between more powerful versus less powerful, larger versus smaller, etc. Scales of relations. So that's the basic concept of it, of what I was trying to do in that chapter. And then the primary actors, as described in that chapter, are people typically who are directly proximate to the day-to-day realities that they're trying to work on. Whether they are people who are quote-unquote practitioners, again, I'm thinking about this in terms of health and care, for delivering services, as it were, or people who are working actively in that community, often people who are receiving services, but people who act on their behalf to try and change the realities of how services are delivered in that place. So the practitioners, and I call those people emancipators. Right? And then if you zoom out a bit, you have people who are operating at a slightly larger scale, who may be policymakers or people who have the role and responsibility to design that system, for example. And those who may be knowledge workers. I call them professors more broadly. But again, you can sort of see how even in a small community, you have those four categories of people, and you can have them within a nation, you can have them, etc. So that's the logic of that chapter.
That's a chapter that's also closer to the things that I do and makes you think about your own work, where I think you, when discussing that, when you're reviewing articles, you're thinking about paper aims, and you're thinking about how paper aims usually seem to be deficient to actually the questions that we need to be asking. And then you provide two reasons for why you think that's the case. One is the biomedical drive of the field, which I think that is absolutely the case. But also, I think you say it's also a colonial drive of the field. And so this is where I'm stumped a bit, because I was thinking about that, but also the example you gave in the first chapter where you talked about you were in medical school and and the mother who has a child who I think had I don't know if they were sick or had malnutrition, and you're thinking about social ills. But the question that it made me think of, a lot of the examples you give, that is also an example I can provide, yes, from Sudan, but also here. Like here, I work on income and health outcomes in the United States. Is it the colonial gaze that's giving the issue here, or is it that the field in general, the public health field, is mostly biomedical in nature, and that's how it's manifesting? Like I'm trying to think, like, or is it an or and both? What do you think?
It's a both, and again, it depends on how one interprets what is colonial, what colonial means. In other words, colonial doesn't have to mean political colonization, right? Colonial, to my mind at least, what it means is the substituting of agency, right? In other words, that I take your agency and I put mine on it, such that I'm able to do the kind of things that I want to do on your behalf, right? And claiming that it is what you want to do, or that what you want to do doesn't matter because it's what I want to do. So in that sense, colonial. Now, the field of public health, of course, also has the biomedical problem. We've talked about RCTs before. That came from there.
I think we can get into a rabbit hole thinking about also a field of public health is by definition a lot of the time is paternalistic. So there's that as well in nature and how that differs from a colonial lens. But yeah, I appreciate that framing. I think I also and maybe this is an overall comment about the essays and the book, and I'll ask later maybe, but also it felt like this is generally a critique of how we produce knowledge in academia. Like I wasn't sure if this is a critique of global health, and maybe you wrote about global health because this is what you know, but it felt to be all around. It applies to a lot of the things we do in academia in general. The incentives of why I write my paper aims the way I do, or why when I first started working in this field, I was told, if you write a specific paper about Sudan, it's very unlikely for it to get published in a high-impact journal. You should either write about multiple LMICs or write about the US or UK, because those then get a lot more attention. So it was mostly the field and what I need to get tenure instead of just specifically global health. But I don't know what you think.
Yeah, there were many things I was doing in the book that I didn't declare, and I was hoping the people who can sense it will sense it, and those who can't, it's fine. They'll be happy. And one of them is in the first chapter, pretty much saying there's no global health really. right? At some point in the first chapter, I sort of said, let's hope that the word global goes away, because it's not doing any work, to my mind. And so there's a sense in which, frankly, for much of the rest of the book, you hardly see global health again, right? You see global health every now and again, but I don't return to that. So for me, again, this is broadly academia. Again, because I work in health, it refers to health, right? But it is, as you say, and again, I'm hoping that I was hoping that people sort of feel that, and good will have felt that in fields that are completely has no health in their name, right? Like psychology, all kinds of design. But the other thing that I was hoping, again, some people will pick, and I know not everyone will. So this sense that this applies to you if you are working in Sudan and have never left Sudan. In other words, that this is not something it's not international necessarily. Sometimes it is, but often it's just you are a human being with some power, and that makes you often foreign. And how do you deal with that?
Yeah. So the last two chapters, they elicited the most response in me which is interesting. So that chapter 6, the dignity of spectator, that was my favorite chapter. I can't explain why. I read it and I thought this resonates a lot, and maybe because also I know myself and I know I'm a bit literal, and that one actually had the most direct recommendations. At least that's how I felt in what we need to do. That was the most prescriptive, and I just love when people tell me 1, 2, 3, this is what needs to be done. So I like that. I think I was the only one part I was wondering about is actually two things. The first one is when we're thinking about publications, I'm thinking about publications here. So we were thinking about it when we're telling people to say only publish a study when the study connects a system more to itself before publishing. And I wondered, how do we define when we think the results made the system connects more to itself? Like, that seems a bit elusive. So can you maybe tell us a bit more about that?
So that's from the part where I was being prescriptive. It was a temptation that I promised myself at the start of the book that I wasn't going to yield to, but I did in this chapter. And I did because I could not resist the temptation to play around with the structure of a research paper, right? And that was what I was mostly trying to do in that part. I was like, okay, can we break this thing down a bit and sort of see how we can rejig it, right? So that was the spirit of that. And the particular point you mentioned about connecting the system to himself and having a paper do that work first. Here's what I was imagining. I'm not sure if I was as detailed in the essay, but it was a system in which we don't think a research project is done when we have the first draft of the manuscript. That we almost hold it in some kind of suspension. It's available somewhere, I imagine, online, say, on a preprint server. It's waiting there, right? But the work continues. The work of then using that in whatever way it needs to be used. And then giving oneself time to update and refine and describe what that thing looks like. Now, I don't know what that looks like because I think it will be different for each kind of work. Right? And there are kinds of work that won't require that at all, right? Because it's a different kind of work. Right? So again, I'm willing and hoping to be open about what connecting the system to of itself means. Sometimes it could be, again, going back to the 4 sets of actors in a system, it could mean connection across different axes or within. So I'm willing to not be specific there, and just say, okay, just imagine. Again, it goes back to the point of the work, which again, I would hope people are more explicit about. That if this is a work that I'm doing because I want people who deliver services to do a better job, and in this work, I am collecting the perspectives and views of people that they are serving, right? My job then is to connect that to the people doing the job, right? And describe what that process looked like. And my job is done. For some other kind of work, it may be that my job is to help people who are campaigning for XYZ bad practice to stop and sort of trying to help them do their work better. And again, once I've done the work, I go to them and say, guys, here's what I found. Here's how it might be of use to you. Let me know if it's working for you. Let me know if there's anything else I might do for you. Right? Again, document that process. For me, it was a way suggesting to help people think that the research is not done when the first round of findings as I would like to imagine it, are available.
So then, just because I want to get to your writing process, I think that's really important. The last chapter is about to be wronged as a knower. And that's actually a very powerful story. If you can tell us a bit about that story or the approach that you take for that presentation, but also, do you think, I have two thoughts about this. So the first one is, it really just, I agreed with on a visceral level. It made a lot of sense that my mom knows a lot of things that she does in Sudan. She doesn't need anyone to come in and say to her, this is good or this is bad. I agree. And especially also on a practical level where there's a lot of on the ground knowledge that we don't necessarily use. But I think, and maybe I misread it, is based on the conversation we had, is I wondered if the framing of some of the work that was being done when it comes to group antenatal care, if it was about, can we know better, instead of saying this works or doesn't work, can we actually learn from this practice that is in Nigeria, if that was the approach? Or can we say, if the study question was, can we make this 10% better, acknowledging that it exists at a social norm? Would that been a question that you would comfortable with? I think that the part of me that had an emotional reaction to this was the part that says, I think there is benefit in trying to examine things to try to make them better. But I don't know if that was what you were trying to get with that story. Yeah.
So the two examples that you mentioned, the two potential reframings of the questions the researchers were asking that you mentioned there, I hinted at them in the book as well. In fact, there was a part where I said, I know that this is not the best form of it. It couldn't be the best form of it, right? So your question could be, how could we make this better? How could we improve this? But not to pretend as if there's a question to be asked whether it is good or bad, right? It's the binariness of that framing and the RCT-ness of its purpose that was jarring and remains jarring to me. And this idea that there's a long running practice, I've not been able to date it, of group antenatal care that I certainly grew up with, and people whom I know who were mothers in the 1960s had it, right? So I know it's old enough. I've been asking people, like, when you were a mother, did you have this? And people had it a long time ago. That therefore a group of people to come from the US and sort of say that first it was invented in the US, like, a few years ago, and that we are now trying to make it into a global thing. So we've come to Nigeria to set it up and then evaluate it. It's silly, multiple rounds. And that was the point. That if you had come and you're working with people who are intimately familiar with this, and you're asking, can we make this better? Can we optimize this? Or are there practices that need to change? Because sometimes practices need to change. Right? What are they? How best might we approach that, given all the political and the social sensitivities that may come with that? In other words, it's a different, you're in different space completely with knowledge, if that is what you're trying to do. And that was the point of the essay, that there is something going on here that is just not in service of the people who know us in this system. Like, just not. And I'm not sure if that's what you meant by my writing process, but for this particular essay, it began as I started as a story that someone told me that they were going to generate evidence about this thing. With someone who's a friend, a really good friend of mine. And then I was invited to give a talk somewhere, and I decided to turn this into that talk. Right? Use this story to drive that talk. And then as I was designing the talk, I was also imagining people in the audience who would agree with what I'm saying, right? And who may not want to say that they don't agree with what I'm saying, or find ways of saying they don't agree. So there was a process in designing the talk and then writing the essay that was also about me sitting down and thinking about the gaze, right? That I'm in contention with in the process of delivering that talk.
I think that's the interesting part to me, because when I got to the point of saying, but what if we can make it better? Or I actually do agree the question should be asked, are midwives being paid so poorly? That's why, that should be the question that we're asking. I wondered, am I part of the people sitting in an audience and trying to find excuses of why they're asking that question? It's just interesting. It makes you try, hopefully, it makes you try to think, if I'm having a visceral reaction to something, where is that coming from? And what does that say about my pose? And so that was an interesting chapter. Highly recommend read. That was the one that made me really think about like where am I coming from here. So 2 quick questions then about the book in general. The first one, could we think of this as a libertarian manifesto? I kept thinking, you keep saying localizing.
Yeah.
Yeah.
I
Can we localize all the way down to an individual? Yeah.
I one of the chapters has the opening quote is from Hayek, right? And I know libertarians who would hold Hayek up as our guy. And Hayek's theorizing of knowledge is great, right? Of course, it's thinking more about the market mechanism, right, as a tool that to aggregate knowledge that individuals hold in a system. And I think a useful way to think about people is that what we want, or what my hope on behalf of people is that their agency is maximized, their freedom is maximized, and they can make the decisions they want to make, and they have reason to make. And that is our job. The rest will relax, right? In other words, if you are free to do whatever you want to do with your health, insofar as it is your choice, then it's your choice. Now, but there's also the additional layer, which goes back to the idea of subsidiarity. There are also things that in a social system we can negotiate as to what responsibilities are better centralized, aggregated, including how a system is designed, right? Such that the design, again, optimizes people's freedom. Right. So again, for example, I'm often thinking about I was in a room just yesterday at the University of Sydney where we were talking about epistemic injustice, and we're linking it to metabolic diseases. And someone in the room sort of said they did an analysis of children with obesity in Sydney, and they found that the most important reason is the parents are poor. And you can say that for very many things. Right? The most important determinant of health, or ill health, as it were, is poverty. Right? So that, again, when one is thinking about who has the responsibility to design a system that allows people to be free, the most important thing you want to be thinking about is that for people not to be poor. So again, that's how I'm thinking about it. If a reviewer were to say that, I would smile and I would not say no. Right? To say that this is a libertarian, blah blah blah. Like, oh, okay, I see where you're coming from.
Yeah. That's so interesting. I think we need to have a separate conversation, because I want to write an article that says a public health vision that goes alongside with paternalism. I've been thinking a lot more recently about paternalism for some reason, but that's a conversation for a different time. The last question here, I guess, about the content of the book is, can we also think of this as a manifesto for incrementalism versus radical change?
No. And here's what I mean. There is again, I'll do one more Yoruba saying. There's a saying that aboro lanso fomoluabi to badene, which basically means that for someone have reason and to assume is wise or good, well intentioned, right? You only say to them half of what you need to say to them. When it gets into their tummy, it becomes whole. And again, the metaphor is that they are swallowing the word. So that's why it gets into their tummy becomes whole, right? In other words, that what I'm doing here is trying to deliver the half, right? In the hope that the other half will be met by what is inside of people, what they want to do. And there are people who are thinking incrementally. There are people who are thinking radically. My hope is that that the other half can be of varying temperaments and textures, depending on what people have inside of them to run with. Yeah.
Got it. Okay, so now just stepping back maybe a bit about and talking about your writing process, just because I think this is an interesting global health book. I don't know if you meant for it to be for public audience, if it's close to public health audience, but I really like the prose. I think we talked about this when we spoke before, but it felt more literary. It felt a bit of more like a memoir, but also some of it was critique. And I was wondering if that was the approach there. Were you writing for a larger audience? Clearly, you love literature. You quote a lot of it. And also, what was your process in writing a book that looked that way?
I always feel, I always like to feel like I'm writing for an intelligent audience who does not need to have any prior health or even academic leaning or experience. Like I'm sure I'm not always successful at that, but that's what I'm always trying to go for. That I want to write for anyone who can think, which means that then I have to write in a particular way, and hope that it's successful often enough. To the extent that I have a process, it is finding the best form of delivering an explanation. I often feel like my job is to explain something, and whatever I need to do to make that work, I'm happy to do, insofar as, again, it allows me to speak to the random intelligent person. So if it means that I marshal a story, I marshal a metaphor, I use a trick here and there, and the goal is, again, the sense is that each reader has something inside of them that I'm hoping the book joins with. And that thing is what determines what the supposed prescriptions are, what the person's going to do with it. It depends very much on where they are, what they want to do with themselves and with their lives. And that is not for me to say for the most part. I can offer perhaps ways to think about it, but the ultimate responsibility is the person's.
So and it's funny that you say that, to be honest. Like, I think if I want to be prescriptive, I think for people who write in public and global health, I would say there is this, in academia, there's this pride in saying I wrote something that a lot of people do not understand. In a way, it seems like people think that corresponds with intelligence. And actually, I would disagree. I think it's you're writing for someone who is intelligent, who thought about the issue, but you should write in a way that is accessible. At least if you're writing from an academic sense, you could, of course, have different ways of writing. But I fully agree with that. But so just the prose itself, I think, felt like it carried like a moral and an aesthetic weight. I don't know if that was the intention. But did you see yourself, you're arguing with the reader? Are you trying to be a witness of your life experiences and other life experiences, or are you trying to invite them to be reflective as the end? And I would add to that, I think we had a conversation about this. It was interesting to me so what were your vision for the reader?
Again, as I described earlier, I'm hoping to reach many people. So I'm hoping to only give half of what is needed. And in that sense, I'm inviting reflection, right? I'm inviting, because I know people contain things, and I want this, whatever I have to say, to mix with that and hopefully help reshape that, clarify that, straighten that, or deepen that, whatever it is. But the hope was, and which is the reason why I held back a lot on prescription, that the prescription belongs to the person who is making a decision what they want to do with this. It's not my job to tell you exactly what to do. And where I was prescriptive, there's a twinkle in my eye, like, okay, I'm like a wink. I felt, at least in writing it, that I'm winking at a prescription at you, that you don't have to take it seriously.
So I think our last question here is, what's a narrative that you think need to be complicated that I think particularly for the field to become the field formerly known as global health?
I think it is the sense that there's a conceit at the heart of how we've understood global health, especially as framed as international. That there's a conceit that one people know stuff, the other people need stuff. One people have stuff, the other people are deficient of stuff. There's a simplification of how the world truly works embedded in that framing of what global health is. And part of what I'm trying to get at here is, can we just all be human beings and just look at ourselves as human beings and begin to realize that we are all many things at the same time, and that we are all deserving of respect and dignity as people who know stuff, again, regardless of what the content of that knowing is. That we are all deserving of that, and can we treat ourselves that way? And I hope that if we did, it would take us a couple of steps towards letting go of global health.
Thank you, Seye. It's been a pleasure today.
Thank you very much, Salma.
This episode was edited by Catalina Melendez Contreras, with marketing and outreach by Kankini Bahaduri. The podcast is supported by the School of Public Health and the Frick Initiative at Washington University in St. Louis. You can find Complicating the Narrative wherever you get your podcast, and you can also watch the episodes on YouTube. If you found this conversation useful, rating, sharing, or recommending the podcast is one of the best ways to help us reach more people. Thank you for listening.